Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Ileostomy Introduction. Diseases of the colon and intestines are common. When diseases of the intestines are treated with surgery, it sometimes results in a colostomy or an ileostomy. A colostomy and an ileostomy are both procedures where a surgeon connects parts of the intestines to an opening in the abdomen where stool drains out. This program will help you better understand what an ileostomy is and how it can be cared for. Anatomy. The inside wall of the abdominal cavity is made of a thin layer of tissue called the peritoneum. A thick layer of muscles covers the peritoneum and skin covers the muscle. Inside the abdominal cavity are the liver, stomach, spleen, intestines. Swallowed food goes through the esophagus and enters the stomach where it is partially digested. Partially digested food goes from the stomach to the small intestines, where nutrients are further digested and absorbed. The small intestines are made up of several sections: the duodenum, the jejunum, the ileum. Fibers and digested food finally reach the colon. The colon absorbs water and is a storage area for stool. The colon has several sections: the ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, the anus. Symptoms and causes. The most common intestinal diseases include cancer, diverticulitis, Crohn's disease, ulcerative colitis. About 1 out of every 15 people gets colon cancer. If found early, colon cancer can be cured. Diverticulitis is a disease that causes the colon to have many small pouches. These pouches are called diverticula. Diverticula can get infected, which can lead to serious medical problems. Crohn's disease and ulcerative colitis are both a type of inflammatory bowel disease or IBD. Ulcerative colitis is found only in the colon. Crohn's disease can be found anywhere in the digestive system. Both conditions can cause serious complications. During surgery on the small intestines or colon, the surgeon may decide to reroute the remaining part of the intestines to the outside of the body through an opening in the abdomen. The surgery to make the opening is called an ostomy. When an ostomy involves the colon, it is called a colostomy. When an ostomy involves the ileum, the last part of the small intestines, it is called an ileostomy.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Ileostomy. Another term used for the opening created on the outside of the body is called a stoma. Since ileostomy patients cannot control their bowel movements, there are special pouches that fit the stoma and collect stool and gas. The pouches are called ostomy pouches. Ostomy pouches do not allow any gas, fluid, or odor to leak to the outside. The pouches need to be changed regularly, and the skin that surrounds the stoma needs special care. People with a permanent ileostomy do not pass gas or stool rectally. If the ostomy is temporary, you may still pass mucus rectally. Bowel movements may be liquid at first and should thicken with time. A few weeks after surgery, you can usually go back to doing the things you did before surgery, but you may have some restrictions. Stoma care. Stomas vary in size and color. A beefy red color is normal. Some stomas bulge slightly outward, some are flush with the skin, and some are drawn slightly inward. The way a stoma looks can change during the day, depending on the activity of the intestines. If a stoma is accidentally bumped, it may bleed a little. This is normal. There are many different types of pouches or appliances that can be used to collect stool. One-piece pouches are applied directly on the skin surrounding the stoma. Two-piece pouches have a wafer that is applied to the skin. The pouch itself then gets applied onto the wafer just like Tupperware. The wafer needs to be changed every 3 to 4 days. Pouches are either close-ended or open-ended. Patients with an ileostomy may benefit more from an open-ended pouch because they have more liquid stools. When either kind of pouch is placed, you need to make sure that it fits well around the stoma and that it does not allow any stool to leak. Special paste is available that will make a secure seal. When changing pouches, you should clean the surrounding skin well. Soft paper towels can be used to clean the stoma and surrounding skin. You can take showers with or without a pouch on. It is important that the skin is dry before a new pouch or wafer is applied. Hair on the skin surrounding the stoma can be clipped with scissors or an electric razor. It is best not to use regular safety razors. Nutrition. Regular, well-balanced meals are recommended. Follow the diet restrictions you have been told to follow before surgery, i.e. diabetic, cardiac, low-fat. Chewing well helps food to get digested and decreases the chance of the ostomy becoming blocked. Since stools may be watery due to diarrhea or small bowel output, you could lose a lot of fluid without noticing. Therefore, it is important to drink fluids to replace the fluid lost through the stoma, especially during hot weather or after exercising. Watery stools also cause you to lose 2 important minerals, sodium and potassium. You can replace these minerals by eating or drinking foods with potassium and sodium within your diet restrictions. Nutritionists can recommend special diets for you. It is best to try new foods individually to make sure that specific foods do not cause gas, bloating, or bad odor. Some foods, if not eaten in small bites and chewed well, can cause blockage with an ileostomy. You should tell your healthcare providers about your condition. Some medications, such as capsules and enteric-coated pills, may not get totally absorbed by the remaining intestines and may need to be replaced with a liquid form of medicine. Stool problems. Bowel movements have distinctive odors. The pouches have a built-in odor barrier. Odor can be detected when the pouch is opened to be emptied, if the end of the pouch is not kept clean or if there is a leak. It is important to change or empty the pouch when it gets to be 1/3 to 1/2 full. Using special deodorizer in the pouch may also help reduce odors. Be aware of gas-forming foods. Not all gas-forming foods may affect you. Learn which foods cause you gas by eating small amounts, one at a time. Some foods that commonly cause excess gas include asparagus, cauliflower, beans, alcohol, fish, onions. Passing gas is due to when and how food is eaten. Most passed gas through the stoma is simply swallowed air. Since eating fast causes air to be swallowed, it is best to eat slowly. Swallowed air can result from chewing gum, drinking through a straw, or drinking carbonated drinks. Foods that may increase odor include beans, beer, broccoli, Brussels sprouts, cabbage, eggs, fish, garlic, onions, some spices. It is important to eat meals regularly. Skipping meals actually increases gas. To prevent the stoma from becoming clogged, it is important to take small bites and chew everything well. Some foods that can cause blockage with an ileostomy include celery, popcorn, raisins, coleslaw, nuts. Diarrhea can happen, for example, from the flu. There are some foods that may thicken the stool: applesauce, bananas, cheese, creamy peanut butter, white rice or toast, yogurt. Urgent signs. You need to recognize situations that require you to call your healthcare provider. The following pages discuss urgent signs that would require you to call your healthcare provider immediately. Diarrhea that lasts more than 1 day. severe bleeding from the stoma. If the stoma turns black, severe abdominal pain, bloating, or fever. Sexual activity. Sexual function is usually not affected by an ileostomy. When surgical incisions are healed, it is safe to have sex. It is important to discuss this with the healthcare provider first. Incisions usually heal within 5 to 6 weeks after the operation. An ostomy pouch should be changed before sex. Sometimes it is possible to cover the pouch with a garment of clothing, depending on what makes you more comfortable. To prevent rubbing against the stoma, certain sexual positions may need to be adjusted. After the procedure. After surgery, give yourself time to recover. Having a stoma should not prevent you from returning to work and participating in any activities prior to surgery, but you may have some restrictions such as participating in contact sports. Most people who have an ostomy live active lives. You may want to ask about local ostomy support groups in your community. Taking good care of a stoma and knowing what to watch for is extremely important in preventing serious complications. It is important for you to notify your healthcare provider if any urgent signs or problems occur. The earlier problems are noticed, the better the chances are of correcting them.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Diseases of the colon and intestines are common. When diseases of the intestines are treated with surgery, it sometimes results in a colostomy or an ileostomy. A colostomy and an ileostomy are both procedures where a surgeon connects parts of the intestines to an opening in the abdomen where stool drains out. Another term used for the opening created on the outside of the body is called a stoma. Since ileostomy patients cannot control their bowel movements, there are special pouches that fit the stoma and collect stool and gas. The pouches are called ostomy pouches. Ostomy pouches do not allow any gas, fluid, or odor to leak to the outside. The pouches need to be changed regularly, and the skin that surrounds the stoma needs special care. You should tell your healthcare providers about your condition. Some medications, such as capsules and enteric pills, may not get totally absorbed by the remaining intestines and may need to be replaced with a liquid form of medicine. After surgery, give yourself time to recover. Having a stoma should not prevent you from returning to work and participating in any activities prior to surgery, but you may have some restrictions such as participating in contact sports.
Thank you for using Explain.